COVID-19 was initially thought to be a disease that was serious for the elderly and people with pre-existing conditions, a potentially tough but temporary respiratory illness for everyone else. But now, 8 months into the pandemic, younger patients who've had relatively mild cases of COVID are showing up in doctors' offices and emergency rooms with mysterious and debilitating symptoms. It's not unusual for viruses to cause after effects, but as you'll hear tonight, doctors tell us they've never seen anything like this. While researchers around the world are scrambling to figure out what's happening, Mount Sinai Hospital here in New York opened one of the first centers to study and treat people with what they're calling post-acute COVID syndrome. The patients we met have a less clinical term. They call themselves long haulers.
The story will continue in a moment.
It's like a viral tornado that goes in you and kind of just messes you up, and then like it kind of leaves, but leaves something behind.
It leaves the rubble that a tornado
The
leaves
rubble,
behind.
yeah. It leaves the damage behind.
Seti Nagamutu was 44 years old and a personal trainer in New York when she got COVID in March. She was able to recover at home, and when she tested negative in May, she thought her life would return to normal. It hasn't.
There are days where I do nothing and just can't get out of bed. The migraines, they're like 10 times worse than a flu headache. Pains, like muscular issues, and there are some times where my hands feel like they have pins and needles, and I have to stop using them because I can't feel anything.
Some people who are going through this call themselves long haulers. Do you think it's going to be a long haul?
It has been a long haul.
8 months after getting infected, she says she can't work out or work in the gym. Just walking upstairs sends her heart rate soaring.
The grocery store is like the dread for me.
What's hard about the grocery store?
I cannot lift bags and walk.
You're a full-time trainer,
Yes.
and you can't lift grocery bags.
Correct.
Sadie has seen half a dozen doctors in the past 6 months. Her bedside table looks like a medicine cabinet.
Both arms go up and over your head.
She's been diagnosed with post-viral fatigue, inflammation in the lungs, and tachycardia, a rapid heart rate, but no one can tell her exactly why this is happening.
Here we go.
It's got to take such a toll mentally to still be dealing with this.
It's depressing, is really what it is. Nobody can really understand or relate to you except somebody else who's had the same problem.
What's been worse for you, the initial infection or the aftermath of COVID?
The aftermath, without a doubt.
Nitza Rochez also got COVID in March, and by May, the infection was gone. But 191 days later, she's still struggling.
I was sick with COVID. But this post-COVID experience has been beyond the worst experience of my life.
Nitza loved to run. 3 years ago, she completed the New York City Marathon, and the following year, Berlin. At 43, she was training for another race when she got infected.
There's a slight unsteadiness. But
Now, she tells us she has trouble walking more than a few blocks down the street. Nitza says she's had so many strange and unrelenting symptoms, she started documenting them on her phone. She got tremors in her hands and had problems with her balance.
I had headache, dizziness, blurry vision, double vision, heavy limbs.
It's a lot.
It's a lot.
For months, she experienced memory problems, trouble finding words, and confusion, something many long haulers grapple with. They call it COVID brain fog, and Nitza says it made everyday tasks nearly impossible.
It's an odd sensation. It's as if though I've taken Benadryl, kind of like a disconnect, a cloudiness to my head.
But Nitza says the most terrifying symptom was when her legs started to give out.
I moved in with my sister, and she said, "Why are you walking like that?" And I said, "I don't know, maybe I'm just tired." And I think 3 to 4 days after she mentioned that, I woke up and my legs felt so heavy, as if though a weight was pulling me down, that my legs didn't support me, and I just kind of like fell. I just got an MRI.
She went to the emergency room and requested an MRI and a full blood workup. Everything came back normal.
The doctors were like, "You're fine, you're having anxiety attacks, you're just nervous, breathe.
They thought it was in your head.
They thought it was in my head. And it's one of those moments that I'll never forget. Because how could I possibly be fine? And when I left the emergency room that day, I was like, I'm just going home to die. Sorry. Sorry. You don't mind.
Even recounting that is emotional. To be told what you're feeling is not real.
Precisely.
She eventually found her way to Mount Sinai Hospital's Center for Post-COVID Care in New York. There are 40 doctors working with the center, most of them specialists, focused on treating and studying long haulers.
The average age of patients who are feeling this post-acute COVID syndrome are 20s to 40s. They were relatively healthy before.
Dr. Dana McCarthy is a rehab specialist at the center, which has treated 1,000 patients since it opened its doors in May. There's a wait list to get in.
The vast majority of the patients that you see here at the center were never hospitalized.
Correct.
So they weren't on ventilators. This is not ramifications from being in the hospital.
Correct. Yep.
Dr. McCarthy is treating her patients' symptoms as best she can, but isn't much closer to understanding what's causing them.
Do we know now what's going on?
No.
No.
No, we still don't know. Yeah.
I think it's a little bit of a mystery. And let's take a little bit out of it. I think this is a mystery.
Dr. Zijian Chen heads up the center, which Mount Sinai modeled on the hospital's approach to another public health crisis, the September 11th attacks.
This virus has many different effects on the human body, just like what 9/11 did to, those survivors. So as a kind of catastrophic event at one time that causes a large group of special patients, in a way, this is very similar to 9/11, but on a much grander scale.
The pool of patients is much larger.
Absolutely.
Mount Sinai is studying commonalities among that pool of patients, using data they've compiled, and is scanning the long haulers' brains, lungs, and hearts using high-resolution imaging to see exactly what damage the virus might have done. The lack of answers and the skepticism many of these patients face have contributed to high levels of depression and anxiety, though Dr. McCarthy says that's not what's making them sick.
You believe it's not in their heads. You believe them.
Yeah, I have to, because I feel those symptoms too, and I don't think it's all in my head.
Dr. McCarthy had what she considered a mild case of COVID in March. But 8 months later, she says, like so many long haulers, she still finds it hard to get through the day.
I basically do my work and I go home and I go to sleep. That's what I'm capable of doing right now.
And at the end of the day, do you feel way more tired than you normally would?
So at the end of this day, because of what's happening right now, and because of the meetings that I have after this, I will have probably the most excruciating headache. And I will just take some Tylenol and curl up in a ball and go to sleep and hope I feel better tomorrow.
Dr. McCarthy knows better than anyone there's no clear roadmap for recovery.
Ready to get started?
Yeah.
Nitza Roches is seeing a physiatrist, a neurologist, and a cardiologist. She's been prescribed physical therapy, breathing exercises, and dietary changes, as well as blood pressure medication and steroids.
So at this point, it's not that we're doing anything in terms of rocket science.
It's not like people come here and there's some drug that nobody knows about that you give them and
Absolutely not, but that's what makes it even more difficult, right? It'd be so easy if that was the case.
There are patients who come to the center with diagnosable damage from COVID, especially in their lungs. But as many as 85% of patients here show no clear cause for their symptoms. One theory is that the immune system, which was fighting the virus during the infection, is still in overdrive.
So there's a foreign invader, right? Your immune system's the army. It's never been met with anything like this before, right? So it builds up a massive army and then it goes and fights this.
And even after the battle's done, the army is still tromping around.
So it's very possible that the immune system didn't quite calm down.
Doctors are looking into whether a ramped-up immune response, both during and after the infection, could be wreaking havoc inside patients' bodies.
Because the virus kind of goes everywhere after it goes to the lungs, the immune response actually goes everywhere as well. So part of the damage is from the virus itself, but your immune system is also doing damage to your organs.
What does that mean? The immune system is doing damage to your organs?
So your immune system, when it's active, what it does is it starts fighting the virus by activating these cells that kill the virus. But what happens is sometimes these cells, they damage the organs that the virus is next to. So it's almost like collateral damage.
Sometimes the only way to spot that damage is on the autopsy table after a patient has died.
What can you learn about the living by studying the dead?
Because we don't know anything about this disease, an autopsy is the most useful because it will help us determine how this virus is actually making people sick.
As head of autopsy and neuropathology at Mount Sinai, Dr. Mary Folks examined more than 100 people who died from COVID. Early on, she was stunned by how widespread the destruction was.
So people think of COVID as a respiratory illness, but you're seeing damage all over the body.
So there's damage in lung, heart, brain, kidney, liver.
Dr. Folks told us some of the damage could be caused in part by the amped-up immune response. But she also spotted something else.
We saw small and very microscopic blood clots in the lungs, the heart, the liver, and significant blood clots in the brain.
Is that something you expected to find?
No, not at all. Nobody's seen it like this.
Blood clots can lead to strokes, which Dr. Folks frequently found in the brains of COVID victims.
So this is the right side of the cerebellum. The cerebellum is responsible for our balance.
So that indentation, that brown wedge?
Yep.
That's a stroke.
That's a stroke.
Dr. Folks' patients may have been the sickest of the sick, but her work might offer clues for Mount Sinai researchers who are collaborating with colleagues around the world to figure out what's causing symptoms in living long haulers.
I'll see you in 6 weeks, okay?
Dr. Dana McCarthy hopes her patients won't have to wait for answers.
We have the expectation of patients getting better. Why? Because there's nothing to say that they won't yet.
Have any of your patients made a full recovery?
Not full. I have some that are around 90–95%.
But as new infections keep rising, so do the numbers of long haulers.
There's thousands and thousands of people that are going through this. The numbers are enormous, and that's why it's so impactful.
Impactful not only on people's lives, on the economy, on...
Correct, on the healthcare system.
On
How about the
families.
burden of care for the healthcare system that now has young patients, right, who if we don't do something now to try to get them better, can have a chronic type illness that then requires consistent and persistent money and care.
Nitza Roches says she has made some progress in recent weeks, but still has a long way to go.
Do you think he'll run again?
Yes. I was expecting to be running by now. So it's kind of a sensitive subject for me in general, but I'm hopeful, yes, I will be running again.
It's a mental battle, it's a physical battle, and you're still trying to get across the finish line.
Yeah, that finish line seems very far away.
This past week, Dr. Mary Folks, the head of autopsy and neuropathology at Mount Sinai, died suddenly of a heart attack. Her work helped inform Mount Sinai's COVID treatment protocols since the beginning of the pandemic.